We're also, of course, following all the developments in Nova Scotia 4 days after now the massacre there. CBC News has obtained audio recordings from fire and ambulance scanners, and in case you haven't heard them, they reveal a very frantic, chaotic situation as emergency responders were trying to figure out just what was unfolding. But let me turn now to my colleagues. Well, that's not my colleagues. There you go. That's the front door of the Prime Minister's house, Rideau Cottage, where he will emerge in about 15 minutes' time. And to set up his daily briefing and what we might expect, let me bring in my colleagues, the host of Power and Politics, Vashi Kapellas, and the CBC's Catherine Cullen. Good to see you both. There was a significant announcement yesterday in relation to students, $9 billion total. I keep asking people inside government, have we run out of things to announce or run out of money yet? And it would seem the answer is no, because this is supposed to be another fairly significant announcement today, Vashi.
Yeah, another significant announcement with another significant price tag. My understanding is it will focus, as you pointed out, Rosie, on science and specifically research behind developing some kind of treatment and or a vaccine for COVID-19. A significant chunk of change altogether. The government has already announced a bit over $200 million, I think $248 million towards this. They will add $750 million, bringing the total amount invested in this kind of research to around $1 billion. They'll also develop what I'm being told is a task force focused on immunity. So the idea of serological testing, we've talked about this and sort of that it's been approved in the United States, but it hasn't yet. It's going through the process here. That's the antibody testing that will be able to tell us through a blood test if we've had it or not. It's also what's so incredibly central to the idea of reopening the economy or loosening restrictions. We've heard from Premier Scott Moe, and I know he's coming up later today to reveal exactly what his plan is for Saskatchewan. We just heard from opposition leader, Conservative Party leader Andrew Scheer, who says he wants the federal government to release a plan on how to reopen the economy or loosen those restrictions by next week, guidelines at least for that. Central to even the concept or the possibility of doing that all is testing. And we have been talking about that for weeks. That kind of testing, figuring out who has immunity, who doesn't, what communities have it, what geographic areas have it. That is what I'm told the task force will focus on, and it'll be led by Dr. David Naylor, who had a lot to do with figuring out what happened during SARS and is a significant medical figure in this country. So an announcement very much geared to developing a plan to reopen things and to restart things, but obviously through science.
Right, and Dr. Naylor was, you're right, he wrote that federal report on the response to SARS, but he was also the person who recommended the creation of the Public Health Agency and the Chief Public Health Officer. So that was a turning point in many ways for Canada in terms of how it deals with public health. I'll turn to Catherine, if I can, on some of what Vashi touched on there, and I'll come back to you because I'm sure you have things to say on that too, Vashi, but that is the reopening piece of this, and we are going to take that press conference from Premier Moe live on CBC News Network because it will be important and significant, and perhaps, I guess, the first province to really outline what their plan is. And we know that this is an ongoing conversation between Ottawa and the provinces, Catherine. How will this work, and who will do it first, and all the things that they have to think about in relation to that?
And it's interesting, Rosie, if you look at the picture across the country right now, you talk about Saskatchewan sort of leading the pack on this discussion. And I think probably in part that has a lot to do with the picture in Saskatchewan, the fact that they have not been as hard hit as, for instance, Quebec, which I'd like to talk about in a minute. But we already have a bit of a sense of what Premier Moe is going to talk about today. He outlined last night that this is going to be a 5-phase approach. We know that there are still going to be some measures that he says are going to have to remain in place. For instance, a ban on large gatherings, restrictions on travels, concerns about seniors' homes, but specifically what this will look like, I think people across Canada, certainly outside of Saskatchewan, will be watching with interest. At the same time, Quebec is having a very live discussion about what reopening there might look like, but of course, the picture in terms of the COVID-19 outbreak, very different. They, in particular, are dealing with not only a problem in terms of the scale of the outbreak, but specifically in their long-term care homes. The World Health Organization, for instance, and I know that's an organization that is being certainly critiqued, we can say, in some quarters right now, but they have put out 6 guidelines for what any society, any jurisdiction needs to do in order to reopen. And one of the things that they have flagged as a concern is that any outbreak in special circumstances like long-term care homes be under control. When we look at what is happening in Quebec, when we look at what is happening in Ontario, I think there's some very serious questions about that. We know that yesterday we heard from premiers of both of those provinces, Ontario and Quebec, asking for help from the armed forces just to get enough manpower, people power in order to keep these homes functioning to serve basic needs. Quebec had put a call out within the province asking people for help. The premier there said they had a hard time finding people who could make that 2-week commitment to one facility. So instead, now they are once again, frankly, asking for help from the armed forces. But all of that forms the picture of what needs to happen. Now, some of the news that we're getting today about testing and working on that, but also questions about dealing with some of these outbreaks as well.
Yeah, and I should say yesterday Dr. Tam was asked, how many tests should we be at? We're doing about 20,000 a day right now. And she says nationally we have the capacity for 60,000 a day. So we have a long way to go in terms of reaching that capacity. Vashi, before I get to an interview, I'll just quickly ask you your take on that dynamic between Ottawa and the provinces, and particularly given today we will hear more about how at least one province wants to handle the reopening.
Yeah, I think it's something to watch over the coming days, Rosie. I think that we've seen south of the border, there is already emerging a very patchwork effect. The federal government there has released guidelines, but it seems that states have a lot of leverage, obviously, given jurisdictional issues about how fast they want to open up. But the risk and what the scientists have continually and doctors have continually pointed out to us is that if you do reopen too quickly, we are expecting subsequent waves. They're supposed to be smaller, but there's nothing saying that they won't be bigger. And we've seen evidence of that in some other countries who at first handled things really well and then saw, mini breakouts or increases in numbers. I'm thinking, for example, of South Korea or Singapore. So it is, a kind of worrying thing. It's understandable, of course, that provinces that are seeing success at this point want to talk about reviving the economy. People are hurting in very real ways, financially for sure. It will be interesting to see, though, what is the dynamic between the provinces and the federal government. Does the federal government come up with a set of guidelines, a set of metrics by which, each province has to meet a certain number of tests or a certain level of immunity in order to be able, to offer some kind of phased approach? So far, we haven't seen the federal government be too interventionist on any of that, but also we're just starting to see provinces talk about what that may look like. So certainly something to watch for in the coming days. And I have a feeling, given the number of provinces that are seeing fewer cases, the issue will sort of percolate and be there sooner rather than later.
Yeah, and there is, we believe, a call between the Prime Minister and Premiers tomorrow. Okay, I'm going to leave you two just both briefly while we wait for the Prime Minister to come outside of his home there at Rideau Cottage. Catherine talked about the long-term care homes. That they have become, of course, the front line of the pandemic in this province, in Ontario and in Quebec. You heard there the province is now asking for military support. Many of the residents in these facilities are older Canadians, but not all of them. Jonathan Marchand has muscular dystrophy, and he lives at a long-term care residence in Sainte-Anne-de-Beaupré, where there aren't any confirmed COVID-19 cases so far. Jonathan is also the president of an organization called Assist, a nonprofit that advocates for people with disabilities, and he joins me now. Good to see you, Jonathan.
Good to see you.
And I know you were on Power and Politics last week, but I found your story and what you were saying very compelling. So I wanted to make sure people saw it and heard from you at a time like this. So tell me what you're worried about right now if there are no cases of COVID-19 where you are currently living.
Well, I'm sorry for my life, to be honest, because to me, the virus is a threat, but the lack of assistance is a real threat, because when there's an outbreak in a long-term care facility, there's a breakdown in all the services, and now they're calling on the army to save people. So it's not a safe environment. What I want is to be able to get out of here with the assistance I need and manage my own care and be able to assure my own safety.
And what is preventing you from doing that? I would imagine money would be part of it, and having the staff and the people that you need to do that.
Yeah, well, the government is spending hundreds of thousands of dollars to keep me here in a long-term care facility. What I'm asking is part of that money to be able to hire my own assistant and manage my own care and choose the place I want to live. So that's something that can be done very quickly. I asked 10 years ago to order my release. Throughout the country, prisons are being asked to release some inmates. I think some people who live in long-term care facilities should have the option to get out with the support that they need.
The Minister of Public Safety, Bill Blair, has just tweeted that he will send in the Army, the military, into Ontario to long-term care. There's been about 125 people deployed into Quebec. What does it tell us, Jonathan, about the state of long-term care inside Quebec, if that's where we're at, that's the kind of help that is needed?
Well, it's a total failure from the government to do anything, really. They had maybe a month to prepare, to do things. They didn't act. All they did was to prevent visitors. And then they went back on that as well, like a week ago. So to me, is that the whole idea that it's a good idea to force people to live in long-term care facilities is a dangerous proposition, and we need to have the choice and the right to live in the community in Canada. Often people are forced to live in those places.
You and I are the same age. You're 43, so you're a young guy with muscular dystrophy. How is your health in terms of making you vulnerable, in particular to COVID-19, beyond the fact that you're in the long-term care center?
Well, the virus, I don't want to catch it. I don't think anyone wants to catch it. In my case, if I catch it, they're gonna have to put me in ER, in ICU somewhere. It's gonna be very complicated because I use a tracheostomy, and my airway are exposed, so it's quite complicated. And as I said, the major threat is that I need 24-hour assistance. I always need someone not too close, not too far from me. So if there's not enough workers, for example, that's a direct threat to my life. And even now, they can't even provide me with the assistance I need inside this facility. I almost died many times in the last 10 years, and they're doing nothing for that. What I need is personal assistance, and it exists in Ontario, in BC, in Manitoba, in the US, in Europe. There's no reason why we can't have an alternative to institutionalization.
Yeah, and I know that's something you've been advocating for a long time, long before the pandemic, but obviously now the urgency is even greater for you. Are you, you're obviously a really strong person, but are you scared? Do you have moments where you're just very, very fearful in a way you haven't been before?
Yeah, it's lots of hopelessness, I'd say. I got nothing to look forward to. What's the plan? Even if I stay here and I ride this crisis and I come out alive, then what? I'm still here. I'm still condemned to live here the rest of my life. I want a future like everyone else. I want to contribute to Canadian society. I want to be able to work. I want to be able to live with my partner, but it's impossible in this place. So I want to get out as soon as possible. Have you seen a change? You alluded to the fact that you're not necessarily getting the care you need even now. Have you seen a change in the level of care because of the pandemic? Like, are there employees who aren't showing up for work because they are concerned? What can you tell me about that? No, here there's a shortage of staff. It's been years. It's always been like that. So it's essentially the same thing. But when there's an outbreak, what we see is that almost half the workers have to take a leave because they're contaminated or whatever. And that's very dangerous for everyone involved, including the workers. that's what we're calling on the army now. So I think in the medium and long term, I think we need to stop putting people in long-term care facilities, and we need to be able to, those who want to get out need to be able to get out. We can't expect to do the same thing and expect different results. We need to transition to another way of doing things.
The vast majority of people I've spoken to from long-term care centers, it has been mostly people who have their parents, older Canadians, much older Canadians, inside long-term care centers. I'm not sure we think or talk enough about people of a different age who have a lot of physical demands and who are in these centers. What would you like the Prime Minister, who we're waiting for right now, the government, the Quebec government, to know about the fact that this is not just people nearing the ends of their lives. This is also people, younger people, who have much a life left to live too.
Yeah, well, in Quebec particularly, we're invisible. We're not considered. They don't talk about us. It's like we don't exist. First, I acknowledge our existence, and second, respect our human rights to live in the community and participate to society. Stop excluding us, and it must become a right to live in the community in Canada and to be included in Canadian society.
And so for now, no cases in the place where you're living, and so you are just going to do what? Wait and see, or how is this going to play out for you?
Until I breathe, I will fight to get out of here. That's the only way I'll be able to be safe. And I'll continue. I'm going to continue to give media interviews, and all the recourses are on the table. I will not stop until I'm released, until I prove that there's another way of doing things, and I open the door for all the other who want to get out.
Well, you certainly make a good case for it, Jonathan. I do appreciate you making time again to talk with CBC. And listen, I wish you the best with this case that you're making, but also I wish you continued good health inside the home, and I hope it stays healthy there for you as well.
All right, thank you.
Merci beaucoup. Jonathan Marchand, he's a resident of a long-term care home in Quebec and the president of Assist, a non-profit organization that advocates for people with disabilities. And of course, as we've been talking about, the situation for long-term care centers has become really an epicenter across the country, but very particularly in Quebec and in Ontario. Yesterday, we saw the Premier of Quebec, François Legault, mention that he may need as many as 1,000 military soldiers to come into the province to help inside those centers. The Premier of Ontario, Doug Ford, made a similar plea yesterday and then followed through with an official request, which is how these things have to unfold, to Public Safety Minister Bill Blair, who today says that indeed the federal government will respond to those needs. It usually takes a little bit of time to figure out what the needs are and where the people need to go. But undoubtedly, that request will also come from Quebec because they are really struggling in containing anything, in helping fight the pandemic inside these places, and in finding enough employees to look after people like Jonathan and other older Canadians who are inside these facilities who need various degrees of care. I'll bring in my colleagues again, the Prime Minister probably coming out in just a moment. Vashi, I know you talked to Jonathan last week. It's a very moving story, in part because it's a long-term fight that he's having. Obviously, in Quebec, the situation is much different, but it is exacerbated by COVID and the fact that he knows that he is very vulnerable to the pandemic inside that center in particular.
Yeah, his story really stuck with me, Rosie. I'm so glad that you highlighted it today. I think the word that he used, I think he used it with you, but he also used it with me, was powerless. And yeah. I can't imagine, given how sort of how much of an advocate he is, to feel so powerless in this situation, and for that lack of that sense to be exacerbated so dramatically right now because of the situation with COVID-19. That first question you asked him, for me, underscores this whole situation. What does it say that in these two provinces right now, we have long-term care systems which house our most vulnerable citizens, be they with disabilities or senior citizens, and we had to call the army in. The army had to be called in order to deal with this situation. I think that is a question as a society and as different levels of government we will probably be asking ourselves for weeks and weeks and weeks. I just quickly, as we wait for the Prime Minister, would add, the federal government has offered a set of guidelines, a set of voluntary guidelines. They've also talked about topping up wages for people who work in these homes. One of the big things that we've heard from Jonathan and others who live there is that they are chronically understaffed. And for those who do staff them, they are chronically underpaid. The federal government has said they're working with provinces in order to top up wages for people who earn less than $2,500 a month. The Minister of Employment said yesterday that those talks, according to the Finance Minister, are going well. She could not offer at this point, though, a timeline for when exactly that top-up would kick in or how exactly it would work depending on the province in which you live. That will be significant information, and I feel like I keep saying it, but time is of the essence, right? As this continues to almost spiral out of control, particularly in Ontario and Quebec, staffing issues and the ability to deal with it inside the setting are of the utmost importance.
Yeah, and there are some latest numbers from Ontario, at any rate, on long-term care. 132 facilities have reported at least one case. 516 residents have died so far due to infection, and more than 2,000 residents have tested positive, more than 1,000 staff positive. So that's the other part. I mean, as staff, of course, become sick, they can't come into the long-term care center anymore. They have to be replaced. Presumably, some of those people can be replaced by some sort of basic help from the military, but not everyone, because these are very specialized jobs as well. Catherine, I'll turn to you to get you to weigh in on all of this. I know that the essential workers piece is going to be talked about with the premiers tomorrow again. Good to know that they're making some inroads, but it isn't there yet.
Yeah, I think Vashi made a really important point about time being of the essence here. And this conversation did make me think of something I know you seized on before in these specials, Rosie, which is something Dr. Tam has said, which is that she believes that one of the legacies of this outbreak is going to be some changes to how things work in our long-term care facilities. I'm sure that that's something that all Canadians hope. Obviously, and it seems trite to say this, but it is terrible that it's taken this to provoke some of these kinds of changes. It was interesting to hear the language the Prime Minister was using yesterday as well when he was asked about some of this. And he talked about, I believe the word he used was vulnerability. The vulnerability not just of the people who live in these facilities, but also the vulnerability of the people who work there, their economic vulnerability, which speaks again to the prospect of this top-up to try to keep people working in those facilities. This is a discussion that's been going on for many days now. I know some of the provinces, representatives from provinces that I was speaking to had a lot of questions about how it was going to work, how it was going to be distributed, whether or not there would be a financial requirement on the part of the provinces, whether they had to match money that was coming from Ottawa. And as Vashi says, this all still being sorted out right now. Meanwhile, we see the situations continuing to deteriorate in some of these facilities. Premier Ford, for instance, targeting 5 long-term care facilities that he says need that help from the Canadian Forces, and that Minister Blair has now said that particular request has been approved.
Right. Okay, and we will see what exactly Quebec is asking for and how the government responds. But here now is the Prime Minister of Canada with his daily briefing. Let's listen in live.
Bonjour à tous.
Good morning, everyone.
Today at sundown marks the beginning of Ramadan. For many Muslim Canadians, the coming month will be different than normal, with iftar online and virtual Friday prayers. But that won't change what this special time is all about: generosity, compassion, and service to others. Across the country, Muslim Canadians are on the front lines of the fight against COVID-19 as nurses, doctors, and essential workers. So thank you, and Ramadan Mubarak. Aujourd'hui, les musulmans
Today, Canadian Muslims will be marking the beginning of Ramadan. The next month will not unfold as usual, but the values of generosity and compassion that are at the heart of this tradition are more important than ever. Right across this country, Canadian Muslims are on the front lines of the fight against COVID-19. Physicians, nurses, and essential workers. Thank you, and Ramadan Mubarak.
This will be another difficult day for many families and communities across the country. We're all thinking about those in Nova Scotia who are grieving the loss of loved ones, friends, and neighbours. Yesterday, I spoke with the families of some of the people we lost. They shared stories about their loved ones and their dreams and plans. In the face of such tragedy, their strength is remarkable. I spoke also with RCMP members from the area, and on behalf of all Canadians, I thank them for their service. And I spoke with some local mayors as well to express my condolences. For Torontonians, I know it'll be a hard day as well, as we remember the victims of the van attack on Yonge Street 2 years ago. Together we mourn, and together we heal. Because just as Canadians were there for each other 2 years ago, we're there for each other today. Across the country, people are hanging tartan, blue ribbons, and scarves from windows to honor those who died. With acts of kindness and donations, people are standing with families who are grieving. And tomorrow, with the virtual vigil, we will all have the chance to show the people of Nova Scotia that they are not alone.
For people in Nova Scotia, today will be another difficult day. In the face of such a tragedy, they are showing incredible strength. And the citizens of Toronto will also have a difficult day today. Today, we are remembering the victims of the attack on Yonge Street 2 years ago. Together, we are mourning, and together, we will come through this.
These are tough times, but there is reason to hope. When it comes to COVID-19, what we're doing is working. And to continue on the right track, we need to be thinking not just about the next weeks, but about the next months. We need medium-term and long-term solutions. On that front, I can announce today that we're taking another step forward. We're putting in place an additional $1.1 billion for a national medical and research strategy to address COVID-19. This plan has 3 pillars: research on vaccines and other treatments, supports for clinical trials, and expanding national testing and modeling. Let me start with the first pillar on research. Under this plan, we're investing close to $115 million for research into vaccines and treatments being developed in hospitals and universities across the country. This is on top of the funding we've already provided to support vaccine development in Canada. The second pillar of the plan is to make sure that once we have potential vaccines and treatments, we can test a wide range of options. Under this plan, we will invest over $662 million for clinical trials led by Canada. A vaccine is the long-term solution to this virus, but these drugs will take months to develop, test, fabricate, and roll out. So until we have something ready, we need to control the spread of the virus. And that's where the third pillar of this plan comes in. We're investing $350 million to expand national testing and modeling of COVID-19. This includes creating the COVID-19 Immunity Task Force. The task force will operate under the direction of a leadership group which will include Dr. David Naylor, Dr. Catherine Hankins, Dr. Tim Evans, Dr. Teresa Tam, and Dr. Mona Neiner. We are bringing together top health experts and scientists from leading institutions across the country. Canada's best and brightest will be working on serology testing, blood testing, to track and understand immunity to COVID-19. They'll be looking at key questions like how many people beyond those we've already tested have had COVID-19, whether you're immune once you've had it, and if so, how long that lasts. Over 2 years, we will be testing at least 1 million Canadians as a part of this study. The findings of the research will help with everything from rollouts of a potential vaccine to determining which public health measures are most effective going forward. We will get valuable data, including disaggregated data, to understand the impact on vulnerable populations. And we will also leverage new and existing lab capacity for research. The better we understand this virus, its spread, and its impact on different people, the better we can fight it and eventually defeat it. While this vital research is happening, we're also staying focused on what we can do right now to control COVID-19 and get back to normal as soon as possible. Testing is key. We've now reached 20,000 tests daily, almost double where we were earlier this month. But testing must increase even further before we can reopen and restart our normal activities as a country. You've been doing your part by staying home and practicing physical distancing. It's working, and we can't afford to waste this progress. Aujourd'hui,
Today, I am announcing that we are introducing a $1.1 billion medical and research strategy to fight COVID-19. The first part of this strategy will deal with vaccines and treatments. We are investing almost $115 million in research on vaccines in hospitals and universities across the country. That can be added to the money we have already allocated to develop vaccines here in Canada. The second part of our strategy is to ensure that once we do have potential vaccines and treatments, we can test various options. So we will be investing almost $662 million in clinical trials. And the third part involves investing in tests to model the disease. We are currently putting in place the COVID-19 Immunity Task Force. This task force will be led by Dr. David Naylor, Dr. Catherine Hankins, Dr. Tim Evans, with the support of Dr. Tam and Dr. Niemer. They will be coordinating blood tests that will help us to trace the virus and better understand how we can develop immunity from COVID-19. The findings of that research will help us to do a number of things, whether it is making a vaccine accessible or determining what public health measures are as efficient as possible. While we're carrying out that vital research, we continue to reflect on what we can do right now to contain COVID-19 and return to a normal life as quickly as possible. But tests are the most important component. We are now conducting almost 20,000 tests a day right across the country, and we continue to increase our testing capacity before life goes back to normal.
We're seeing terrible tragedies in long-term care facilities across the country. This is unacceptable. If you're angry, frustrated, scared, you're right to feel this way. We can do better. We need to do better. Because we are failing our parents, our grandparents, our elders, the greatest generation who built this country. We need to care for them properly. Canadians need to pull together. There have been requests for military assistance by both Ontario and Quebec, which of course we will be answering. Our women and men in uniform will step up with the valor and courage they have always shown. In the short term, we will be there with support so that provinces can get control of this situation. But this is not a long-term solution. In Canada, we shouldn't have soldiers taking care of seniors. Going forward, in the weeks and months to come, we will all have to ask tough questions about how it came to this. We will all have to do more to get through this terrible situation. En ce moment,
right now, we are witnessing terrible tragedies in long-term care homes across the country. That is unacceptable. If you are angry, frustrated, or worried, you have every reason to feel that way. We must do better because we are abandoning our parents, our grandparents, and our elders, members of the greatest generation that built this country. We must look after them as they deserve to be looked after. Quebec and Ontario have asked us for the assistance of the military. And these are requests we will be answering. Our military will be providing assistance as they always do. But this is not a long-term solution. In Canada, our soldiers should not be the ones looking after our seniors. In the coming weeks and the coming months, we will have to take a long, hard look at how we came to this. We will all have to do more to get through this situation, which is absolutely terrible. Everyone is doing their part to get through this period. We're all part of the same team. While we do our part, everyone must do their part. Together, we can get through this, and together, we will come back in full force. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Althea Raj, Huffington Post. Line open.
Good morning. Yesterday you said you were going to continue working with the Finance Department and business associations to ensure that small businesses would get the support they need. Many self-employed individuals feel like they have been forgotten. They can't apply for interest-free loans because they have no payroll, and many have thousands of dollars in fixed costs every month, so the CRB changes really do nothing for them. They feel that your government has been more focused on employers and employees, and many face the real possibility of losing their businesses or going bankrupt. So could you tell us what changes you are envisioning for them?
As we said from the very beginning, we worked on measures to help as many people as possible. We brought in targeted measures to help people who'd lost a paycheck, including people who were self-employed. We've moved forward with a wage subsidy that ensures that people who can remain connected to their jobs while receiving 75% of their paycheck, up to $847 a week. We know that these are measures that got out quickly, are getting out quickly, and are broad and are helping millions of Canadians. But we also know that there are people who are falling through the cracks. That is why we continue to work with industry groups, with stakeholders, with MPs and community members across the country who are feeding us challenges and possible solutions. And of course, we are working with an extraordinary public service to deliver those solutions to Canadians.
Follow-up, Althea?
Okay, but that doesn't. Oh, well, that's your answer. Do you regret this patchwork approach regarding the CERB? It's clear that the need is a lot greater than the government anticipated when it drew up the program weeks ago, and I know that there are a number of people in your caucus who argued that it would have been far easier, and it would be far easier to give everyone who's lost income or lost the opportunity to earn income the ability to apply for help and just tax it back from those who perhaps didn't need it as much next year. I mean, did you make the right call, and are you so stuck on this current course of action that you will not deviate from it?
We knew from the very beginning that targeted support to the people who needed it was the best way to do it, and that's why we move forward with the Canada Emergency Response Benefit that has delivered benefits to over 8 million Canadians. Why we move forward with the Canada Emergency Wage Subsidy that is ensuring that people can stay connected to their workplace even if they're not actually doing the work anymore, so that we can bounce back quickly. But every step of the way, we've said we will continue to expand, we will continue to fill gaps. We never expected that we'd get it perfect from day one. Indeed, we knew we wouldn't. But we couldn't let the perfect be the enemy of the good. We needed to get things out as best we could, as quickly as we could, to help as many people as possible. And then we continue every day to make further announcements that fill gaps, that explain how we're going to help those people who aren't hit by the broad measures there to help. We will continue to work on making sure that everyone who needs help gets it.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Good morning, Mr. Trudeau. I'd like to come back to the announcement you made yesterday on students. Right now, there is a lack of staff in long-term care homes, and they're also concerned about that happening in the agricultural sector. And some people are worried that this will be a disincentive to young people to go and work in sectors that will be opening up soon, such as the retail sector, which doesn't offer very high salaries. What do you think of that? Do you think the generosity of your measures could lead to a lack of appropriate numbers of staff? Well, students need help, and we know that COVID-19 is hitting every generation very hard, so we have to be there to help. We introduced a program that will also develop jobs for young people right across the country, 76,000 new jobs in targeted sectors that will benefit from the help of young people. I know young people, I know the youth of this country, and I know that they will want to be part of the solution. I know that they will want to help and contribute to the economic recovery in their own way. And I think that ensuring that they have the money necessary to cover their rent or pay for their groceries or to be sure to be able to go back to school in the fall is the right thing to do. And we will be working together to ensure that we achieve the necessary recovery. But I won't apologize for supporting our students in these difficult times. And as a sub-question, some observers have been proposing that Ottawa create a program similar to the summer jobs program, but in this case to motivate young people to go and work in the agricultural sector. We know that they don't have enough foreign workers at this point, and they're not necessarily very well-paid jobs either. Do you think that's an interesting idea? And if not, why? Well, every year we see young people who are interested in working in the agricultural industry or going back to the land, and they're a very green generation and very much interested in everything that is organic or agricultural in nature. So I know that there are a lot of young people who will be interested in that, and it'll be new opportunities for them, and we will be creating new incentives to direct them to these important industries. I have very great confidence in our young people, and I know they will want to be part of the solution in the midst of this crisis.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, morning, Prime Minister. I'm wondering, there are a number of U.S. states that are starting to ease restrictions, opening up businesses again, starting as early as tomorrow. I'm wondering if you're concerned about jurisdictions that are so close to Canada easing their restrictions so much, even while in some cases their virus numbers are still going up.
We have strong border measures in place to ensure that we're doing what we need to do to protect Canada. As provinces look at their own situation and how we can move forward on beginning to reopen our economy, I know that their decisions and our decisions will be informed by what is working and what is perhaps not working as well elsewhere in the world.
I know that we will continue to have measures in place to protect our borders, to ensure that we can ensure the safety and security of all Canadians. I know the provinces and the federal government are reflecting on the different steps in terms of reopening and firing up the economy again. So we'll look at what has worked and what has not worked in other jurisdictions in order to make the right decisions.
Yeah, I'm also wondering about the Federation of Canadian Municipalities is out today with a request for $10 billion in emergency funding because their revenues have fallen so steeply during this crisis. Are you starting to work with municipalities on a package for something like that?
We recognize that levels of government across the country, orders of government across the country are facing distinct challenges. We've had a number of conversations with the provinces on their financial challenges. And as we know, municipalities are governed by the provinces. We will continue to work with the provinces, but we'll also continue to work directly with municipalities to make sure that Canadians get the services they need, get the support they need. Regardless of the orders of government, we all serve the same people, Canadians, and we need to work together to be there for them. Okay. Nous allons toujours travailler pour être là pour les
We will
Canadiens qui ont
always
besoin
be there
de
for
services,
Canadians who need
l'appui
services
pendant cette
and
situation
support
difficile.
during these difficult times. We respect the province's areas of jurisdiction with respect to the municipalities, and we will continue to work with the provinces on the municipalities issue, and in some cases directly with the municipalities when it's appropriate.
One more question on the phone, please. Operator.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Oui, bonjour, Monsieur le Premier ministre.
Good morning, Prime Minister. I'd like to come back to the assistance provided to Quebec in care homes. Are we talking about 1,000 soldiers being sent in, as was requested? And you're talking about lessons to be drawn. With respect to Quebec, what was not done properly in that area? Because for years we've been talking about problems in these long-term care homes. First of all, with respect to the request for assistance, as we responded positively to the first three requests from Quebec, we will, of course, be responding positively to this one as well. And we are currently working with Quebec to see exactly how we can provide the best possible support. We received that request last evening, so we're working with them now to coordinate the best possible response in terms of numbers and locations. Now, regarding the lessons we have to draw from the current situation, of course, there will be many important questions to look at and find answers to in the coming weeks and months as to how we can better support the seniors of this country. And I think that this crisis has brought home the fact that there are some challenges we will have to meet all together. Follow up? So, as I understand it, you haven't yet set the number of soldiers that will be going in. And a number of days ago, you talked about sending in volunteers and the contribution of the Red Cross. How many additional individuals could come from those groups? Well, I can tell you we will be there to help. People are facing a terrible situation, and we will be there to help Quebec take control of the situation. It's extremely troubling and terribly unfortunate, and we will be there with the military. And we already have 350 military personnel on the ground in long-term care homes across Quebec. We will be sending more, and we will be working with Quebec, and will help with volunteers, with the Red Cross. We will do everything we can, and we'll be there for each other. That's what we do as Canadians. We're there for each other in a crisis, so we will be there this time.
Hi, Prime Minister Molly Thomas, CTV National News. The race for personal protective supplies allows for a way out of China. It's been 500 days since Canadians Michael Kovrig and Spavor were arbitrarily detained. Are you any closer to getting them released? And when was the last time they had a chance to meet with consular officials?
We have been working extremely diligently on the issue of Michael Spavor and Michael Kovrig, who have been detained for 500 days in China. This is something that we have taken seriously from the very beginning. I can highlight that the Minister of Foreign Affairs spoke to his counterpart, very recently to express our continued concerns and desire to see them released soon. The COVID-19 crisis has the Chinese system in a position of not allowing consular visits, but we have been assured that they are in a facility in a region that is not particularly affected by COVID-19, although we are continuing to press both for more details and for better access.
Also, Prime Minister, we've seen a spike in anti-Asian violence in different parts of our country. In BC, an elderly man with dementia was shoved out of a store by an assailant that brought up remarks about COVID-19. We now have a Conservative leadership candidate that is asking for Dr. Tam to be fired and is accusing her, the WHO and China, of being in cahoots. What is your message to Canadians as they see this?
Intolerance and racism have no place in our country. Canada has succeeded because of our diversity. It is one of our greatest strengths. And the millions of Canadians of all different backgrounds who are working together, many of them on the front lines to help their fellow Canadians, deserve better than this from all of us. We need to continue in our resolve to be an open, welcoming, respectful country. And I think all Canadians expect that of every politician. Okay. L'intolérance et le racisme.
Intolerance and racism have no place in Canada, and certainly not in our public discourse. Our country is strong not in spite of those differences, but thanks to those differences. There are people with different histories and backgrounds and origins who are working together, side by side, to fight COVID-19 and to help their loved ones and their fellow citizens. So during these times, we have to unite. We have to come together and not accept intolerance.
Minister Janet Silver, Global News. With one meatpacking plant already closed in Alberta and the NDP in that province calling on 2 more to be shut down, I'm just wondering, what is the federal government doing to protect Canada's food supply from the effects of COVID-19? And are you worried about federal inspectors going into these plants?
We are, of course, very alert to the issue of food supply in Canada. Food security for Canadians is a continued essential priority. We will work with the agricultural industry. We are strengthening processes around the CFIB to ensure both protection for our inspectors and effectiveness in assuring the safety of our food supply and of the conditions in which workers find themselves. We will continue to work with provinces and various jurisdictions to ensure that we are making sure that Canadians get the food that they need.
And in terms of vaccines, you announced earlier funds for vaccine development. I'm wondering if your plan is to have vaccines manufactured here in Canada for Canadians.
We know that developing vaccines is a really important step, and that's why there are brilliant researchers working across the country in coordination and in collaboration with the international community as we all make efforts to develop a vaccine. But once we've developed a vaccine, whether it be in Canada or elsewhere around the world, we're going to need to produce it, and we will see the same kinds of pressures that we're seeing around obtaining PPE around the world to obtain vaccines, which is why part of the investments we're making today is to establish the capacity of developing vaccines and producing vaccines, mass producing vaccines here in Canada. Okay.
Yes, vaccination will be a critical part of our ability to fight COVID-19, and that's why we're investing in research so that Canadians can be part of the research effort to find a vaccine. At the same time, we need to ensure that we can produce those vaccines here in Canada, and that's exactly what we intend to do. Mr. Trudeau, Louis Blouin, Radio-Canada, Quebec is starting to talk about possible reopening of certain regions, and I believe that Saskatchewan will also be unveiling its own plan to do the same. Some people are talking about mid-May to reopening certain businesses. Do you think it's too soon? Do you think the provinces are moving too quickly? Well, I think everyone wants to know when we're going to be able to lift certain restrictions and perhaps return to a semi-normal life. But obviously, until we have an actual vaccine, we cannot talk about a normal life. We can relax certain measures, if appropriate, but while at the same time remaining vigilant and doing a lot of testing. Various provinces are at various stages of the fight against COVID-19, and they will be making appropriate decisions. And at the federal level, Well, we are trying to coordinate and ensure that we are moving forward based on the same shared principles so that we have a common approach to the measures that will be brought into place across the country and the time that they're going to be introduced. Of course, that will vary from province to province.
We know that everyone wants to know when this is going to be over, when we're going to be able to get back to normal life. Well, until we have either a vaccine or significant treatments for COVID-19, we're not going to be able to talk about getting back to normal. But in the coming months, we will be able to loosen a number of the restrictions and rules that we have right now on personal mobility in certain sectors, on the economy. Different provinces are in very different postures related to COVID-19 and will be taking decisions that are appropriate for them. What we're doing at the federal level is attempting to pull together and coordinate all different provinces so that we are working from a similar set of guidelines and principles to ensure that Canadians right across the country are being kept safe as we look to those next steps.
Earlier, you said that we are conducting approximately 20,000 tests a day now, but it's not enough. So what is your target so that we can really start talking about reopening the economy based on testing? Well, Dr. Tam has talked about 50,000 to 60,000 tests a day as an important target. Other people are saying that it could be as much as double that number. I know that we're doing much more now, and that's why we are also increasing our testing and our testing capacity at this time.
Minister Julie Van Dusen, CBC. You've talked about the fact that it's unacceptable what's going on in Canada's seniors' homes. You've also discussed the idea of making sure people make more money in those homes, but that, of course, would be a short-term solution. In terms of a long-term solution, will you be talking to the premiers about putting seniors' homes under the Canada Health Act, which would set national standards and hopefully make sure that seniors don't go through such a terrible ordeal again?
I think there are going to be an awful lot of Canadians asking questions of all their province, all their politicians about what we're going to do to make sure a situation like this could never happen again. What COVID-19 has done has highlighted and brought forward failings in our system, in our country, where the people who take care of our most vulnerable are themselves extremely vulnerable economically. We need to do better, and there will be a lot of conversations that Canadians are going to demand and that politicians will have about what is the best way to ensure that we are properly protecting our elders.
On the issue of the vaccine, which you've said in the past could take a year to 18 months, will we have to wait for a vaccine to hug our family and friends who are outside of our bubble?
The process around reopening, the level of freedom we'll have to visit friends and to work and to go outside will depend on the decisions and the advice that scientists give us around how to keep ourselves safe. We know it may be a long while before a vaccine. There are discussions around treatments for COVID-19 that might work as well as a vaccine. I mean, we've been waiting for and looking for and searching for a vaccine for AIDS for decades now, and it still hasn't come. But there are treatments that mean quality of life for people with HIV have been massively improved. There are different ways of moving through. We will take the best ways we possibly can as we move forward. A vaccine, obviously, arriving soon would be the best solution. But we need to make sure we are exploring all different ways of ensuring that Canadians' quality of life and safety and protection is upheld in the best way we possibly can going forward. Merci beaucoup tout le monde.
Okay, and that is the Prime Minister of Canada giving us his daily briefing on how his government is fighting and responding to COVID-19. The announcement today primarily about how the government plans to invest $1.1 billion into science and research. Some of it for research, as I said, more than $600 million for the beginning of clinical trials, and more money to expand testing and modeling, but also some very strong words there from the Prime Minister for the first time, really, about the state of long-term care centres now that there are military members who are going to have to go into Ontario and Quebec to help. That's the end of our coverage here on CBC Television. If you want to continue watching, you can hit CBC News Network or CBC.ca. I'm Rosemary Barton. Thanks for watching. Hello, I'm Rosemary Barton here in Ottawa. Thanks again for joining us on CBC News Network, streaming wherever you might be in the world on the CBC News app and CBCNews.ca. Ottawa has ramped up the race to develop a vaccine against COVID-19. The Prime Minister has just announced $1.1 billion in new funding for scientists and researchers in Canada. Justin Trudeau also commented for the first time in a very frank way about the long-term care centres in this country. It comes a day after both Ontario and Quebec requested further aid from Canada's military, a request that has now been approved for Ontario and will likely be approved for Quebec. Let me go to my colleagues, Vashi Kapellas, the host of Power and Politics, and the CBC's Catherine Cullen. Maybe I'll start with the long-term care centres, Vashi, because it is the first time the Prime Minister has said this isn't acceptable and this has to be fixed.
Yeah, and he did so by first acknowledging that the request from Quebec and Ontario, the two requests for military help, would of course be honored, but he characterized it as just a short-term solution and said in the long term, we as society and different levels of government are going to have to be asking ourselves questions about how this has been able to exist and how to prevent it from persisting. In fact, the line that jumped out at me that he said was, in Canada, we shouldn't have soldiers taking care of seniors. He was asked specifically by our colleague, Julie Van Dusen, what that means in the long term and what role the federal government is prepared to play. I think the sort of salient thing for our audience and for people watching to know is that long-term care is provincial jurisdiction. Provinces basically regulate it, they maintain it, they develop a system for it. And in many provinces, there is a sort of dichotomous situation in that there's public systems and there's privately run homes as well. And that has created some of the issues that we're seeing right now. So by all of this, I mean to say it's a very layered system right now, and the federal government has not played an interventionist role other than releasing voluntary guidelines. I've asked a number of ministers about it. So what exactly are you prepared to do? If you do give them money, for example, the province's money for essential worker top-ups, will there be strings attached to that? Will those guidelines be more than voluntary? I think that the Prime Minister is correct in echoing sentiments of people right across this country right now. I think the next phase of this is that those people will look now to the federal government to see what kind of leadership they will play in answering the very questions the Prime Minister acknowledges so many Canadians have.
Yeah, I mean, it probably needs an entire overhaul, but you're quite right. Very often the federal government, when handing over health money, does attach conditions. So the provinces have to perform at a certain level, and that might at least get them through a certain period of time here. Catherine, what stood out for you there and what the Prime Minister had to say?
Well, certainly what Vashi just talked about, and the fact that he used the words, we are failing our parents, our grandparents, our elders. I don't think we hear a language like that very often from our politicians, but when we look at the state of long-term care facilities in Ontario and Quebec, the number of people dying, I think, it certainly is applicable. I think it's important, though, to talk as well, Rosemary, about the money that was announced today, that $1.1 billion, the National Medical and Research Strategy. A lot of interesting things in there, a three-pronged strategy, vaccine research, clinical trials, as well as this new task force that's going to look at different issues around modeling and whatnot. I thought particularly in a couple of the Prime Minister's last answers, he touched on some very interesting things about the importance of a vaccine if and when one is developed, that would be something that would have implications too in terms of the supply chain here in Canada, that we would need to produce it in Canada. He made the comparison to what we're seeing with personal protective equipment. I'm sure our viewers can call to mind those stories of competing planes in China trying to get shiploads of equipment, the necessity of being able to produce a vaccine here in this country if one is discovered here or elsewhere, because of course the whole world is facing this problem. But he also made an interesting point at the end. I mean, so much interest, understandably, in developing a vaccine, that being seen in many ways as the only real solution to this sort of only a new normal until then, not getting back to normal. But he talked about the fact, he made the comparison to AIDS, and he said, decades and decades of research have gone into making a vaccine for that. There is not a vaccine yet, but there is treatment. And so that could be part of the picture as well. It's a really multifaceted issue. There are a lot of interesting things to talk about, too, in terms of blood testing. The U.S. is in some ways further ahead, but they've seen some real problems as they've signed off on tests that haven't necessarily been effective. So a lot to unpack there.
Yeah, okay. I want to try and squeeze in a guest if I can before the cabinet ministers and public health officials come out, because one of the other things the Prime Minister was asked about are the outbreaks inside processing plants, meat processing plants. Of the three biggest beef processing plants in this country, the ones that produce the most beef for Canadians, two now have severe outbreaks. And there are other meat processing plants in the country that are hit with the same thing. Cesar Cala is a volunteer with the Philippine Emergency Response Task Force in Calgary, and he joins me now. It's good to see you, Cesar. So the reason we are speaking to you is because many of the workers at the Cargill plant, where there has been an outbreak, are part of your community, the Filipino community. How are people doing, given that this has spread so quickly amongst the workers and the community?
Well, we've been talking with some of the workers and their families and their community members. And so there's a lot of anxiety and fear that they're feeling. They fear about whether their workplace is a safe place to work. And they don't have the confidence right now that that's happening. Many of them actually voiced their concerns as early as 2 weeks ago, when the case count was still quite small. And there were no immediate actions based on their concerns. What they're feeling is that are their concerns and perspectives being dismissed? So they really want the officials and leaders to take them seriously. And that they're also concerned about their economic well-being, of course, because many of them are temporary foreign workers, and their stay in Canada is connected to their employment at Cargill, because they only work with one employee, right? But they're also concerned about the community itself. They know that they have an essential job to do, which is to provide food to Canadians, and they take pride in that. But they're also thinking about whether they're contributing to the spread, and so they're very concerned about that as well.
So it is temporarily closed, I should point out, and there is now an investigation in terms of how this unfolded, why it wasn't closed sooner, and all those things. But I noticed the public health officer, Dr. Hinshaw in Alberta, has said one of the other concerns was, that some of these people were carpooling to work. They're friends, and they hang out socially. And so it wasn't just a matter of working together, it was all the other pieces of this. So I wonder, what have they told you about the concern that they may have, as you just said, maybe spread it to family members or community, and were they told anything about the dangers, the potential dangers of that?
Well, I think they're very aware of their concerns. That's why they were very active in providing this advice to the company. One of the things that people need to understand is that TFWs come here, many of them come as individuals. So when we talk about isolation and being in isolation at home, we are in isolation with our families. They live in multi-resident dwellings because that's the nature of their situation, and they share resources like transportation and so on. So if an action or set of actions need to be developed to address this issue, then the big picture needs to come in, right? Because that's their world, right? And so that's what they're saying, is that their voices and their concerns need to be heard, because they know what their situations are and what kinds of supports and mechanisms need to be in place, right? To address these things. These are not just lifestyle questions. These are situations of their lives.
For sure.
Right?
For
and
sure.
so that needs to be part of the deal.
Let me end on this. So the plant has been temporarily closed. These are, as you say, temporary foreign workers, many of them, not all of them. What have people been told about either their salary or their status in the country? Do you know?
Yeah, that's part of some of the confusion. It's not very clear. So the company has said the plant is being idled, and what does that mean, right? So we've been reaching out to them and to make sure that they are aware of the various options that they have, whether that's EI, CERB, or even because many of them feel that they actually contracted the infection through work. Mm-hmm. So that means WCB, like workers' compensation, right? I also want to state that this situation really highlights some of the vulnerabilities that have already been in place even before COVID-19 about the plight of workers in situations like this, especially temporary foreign workers. I mean, if these are essential services and COVID-19 shows that our food supply is essential, then we really need to think seriously the kinds of supports and the kind of respect and acknowledgement of the workers that are working in these situations. We don't need, essential services shouldn't have dispensable workers.
That's an awfully good point, Cesar Cala. I think we'll leave it there. Thank you. I appreciate you weighing in and giving us a picture of what some of those workers that you were talking to are going through, and please send them our best. Thank you very much.
Well, thank you for this opportunity as well.
That's Cesar Cala. He's with the Philippine Emergency Response Task Force in Calgary. I'll go back to my colleagues, Vashi and Catherine, as we wait for our regular briefing from federal cabinet ministers and public health officials. Let people know, though, too, that at 12:30 Eastern, we are going to turn our attention to Saskatchewan because the Premier, Scott Moe, is going to outline the 5 steps, I believe he has, that he wants to put in place in order to reopen the province in the next couple of weeks. And that'll be of importance, really, to all of us, because it might give us a picture of what other provinces will do on their own timeline. Interesting talking to Cesar Cala there about the meat plant in Calgary, only because it again, not unlike the seniors and the long-term care centers, exposes the fact that perhaps we were not treating workers, essential workers, or temporary foreign workers in the best way, or protecting them in the best way through this. And maybe that too will have to be something that we re-examine as a country. If our supply chains are so vitally important, if our food security, as the Prime Minister said, is a priority, maybe we need to fix the way we are treating people who are doing that essential work in making sure we can all eat. Vashi.
Yeah, and I think to build on that, Rosie, there are some outstanding questions that I know we've all been trying to get answers to as to sort of like the layers of accountability in all of this. And I'm thinking specifically of that meat plant. The head of the union there told me a few days ago that the first inspection that was done based on some of these complaints was done sort of with a cell phone via FaceTime. I have yet been able to confirm that that's the only inspection that was done, but that obviously, left a lot of the workers there feeling a bit uneasy about the level of oversight. They're asking for the federal government, for example, that union to intervene. And I know there are different levels. There's occupational health and safety at the provincial level. There's also the CFIA, the Food Inspection Agency, at the federal level. But I think that you're right in that, this is an environment that is isolated in a way, but they do a service that right across the country we rely on incredibly heavily. So again, I think you're right to point to it, and I think there are questions for both levels of government.
Okay, thank you, Vashi. Catherine, we will come back to you after this briefing if I have time. Let's go now to the Deputy Prime Minister of Canada, Christine Freeland. She's the one who usually starts things off to give us a sense of how things will unfold. Here she is now.
So
here
today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, our Minister of Health, Patty Hajdu, the Minister of Science, Innovation and Industry, Navdeep Bains, Canada's Chief Science Advisor, Dr. Mona Niemer, et le Président du Conseil du Trésor, Jean-Yves Duclos.
And the President of Treasury Board, Jean-Yves Duclos. Dr. Tam.
Afternoon.
Good morning, everyone.
I'll start with the latest numbers on COVID-19 in Canada. There are now 40,190 confirmed cases, including 1,974 deaths. To date, labs across Canada have tested over 620,000 people, with over 6.5% of these testing positive. Although we are still facing considerable challenges, from the need to extinguish outbreaks and ramping up testing and tracing to root out and manage persistent chains of transmission in community settings, today is a great day to consider the progress we've made. There are still a lot of unknowns, but the pace and expanse of evidence-based discovery and science innovation is inspiring. From discovery and genetic sequencing of the virus in January to building our understanding of COVID-19 disease characteristics and spread through tried and true applied epidemiological and public health investigation, we've progressed in leaps and bounds. If we reflect back on prior pandemics in the recent and more distant past, we can see some of the advantages of a more virtually connected, technology-powered society. But this, like everything else, is made better, faster, and more powerful when we work together towards a shared goal. We've seen the power of solidarity in a connected world, with researchers collaborating across borders, data trackers scrubbing the web to share up-to-the-minute stats and charts for all the world to see, and virtual collaboration platforms sharing accelerated research findings on virus strain information and pre-publication scientific studies. It is hard to imagine where we would be without this rapid and open sharing of research and scientific advancement on biomedical, social, and policy countermeasures. While one of the downsides of a highly connected world is the ever-present risk of emerging diseases that spread rapidly around the world, today's announcements give us hope for our future. In a world that is connected and united towards a goal, and with brain power that is funded, supported, and trusted, we can reach a whole new level of capacity to respond to infectious disease threats now and into the future. Go science! Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard.
And now, Dr. Howard. Thank you. Good morning. We will begin by the latest numbers on COVID-19. There are now 41,190 confirmed cases, including, sadly, 1,974 deaths. To date, labs across Canada have tested over 620,000 people, with over 6.5% of these testing positive. Although we are still facing considerable challenges, from the need to extinguish outbreaks and ramping up testing and tracing to root out and manage persistent chains of transmission in community settings, today is a great day to consider all the progress that we've made. There are still a lot of unknowns, but the pace and expanse of evidence-based discovery and science innovation is inspiring. From discovery and genetic sequencing of the virus in January to building our understanding of COVID-19 disease characteristics and spread through tried and true applied epidemiological and public health investigation, we've progressed in leaps and bounds. If we reflect back on prior pandemics in the recent and more distant past, we can see some of the advantages of a more virtually connected, technology-powered society. But this, like everything else, is made better, faster, and more powerful when we work together toward a shared goal. We have seen the power of solidarity in a connected world. With researchers collaborating across borders, data trackers scrubbing the web to share up-to-the-minute stats, and charts for all the world to see, and virtual collaboration platforms sharing accelerated research findings on virus strain information and pre-publication scientific studies. It is hard to imagine where we would be without this rapid and open sharing of research and scientific advancement on biomedical, social, and policy countermeasures. While one of the downsides of a highly connected world is the ever-present risk of emerging diseases that spread rapidly around the world, today's announcements give us hope for our future. In a world that is connected and united towards a goal with brain power that is funded, supported, and trusted, we can reach a whole new level of capacity to respond to infectious disease threats now and into the future. Go science. Thank you.
Merci, Dr. New.
Thank you, Dr. New.
Now, Minister Hajdu. Patty, please.
Thank you very much, Christia. Well, good afternoon, everybody. The question I hear the most often, no matter who I'm speaking to, and often in different words, is essentially, when will things go back to normal? And this is a simple question with a very complicated answer, and one that we need science to better understand the solutions for. What is the virus about? How do we control it? How can we defeat it? These are all parts of the answer to when will things go back to normal. On sait qu'il y a des gens qui ont le COVID-19.
We know there are people, some Canadians, who have had COVID-19, but have never been diagnosed because they had no symptoms or only mild symptoms. We also know that blood tests can detect antibodies to the COVID-19 virus and tell us who in our community has been infected.
The rate and spread of infection, we need data and research that will help us understand the extent of the community spread of the virus. We also need a better sense of what to expect in the coming months during a possible second wave of infection. And we need a better picture to help us guide public health decisions that will be needed as we ease restrictions that are in place right now. This understanding of Canadian exposure is critically important to take the right steps at the right time. And that's why this morning the Prime Minister announced an important Canada-wide study to track COVID-19 infections. I want to thank Dr. David Naylor, Dr. Catherine Hankins, and Dr. Tim Evans for helping us to coordinate and conduct this research that will result in our country being better equipped to plan over the next few months. And this very important research will contribute to our country's ability to manage COVID-19 well into the future. I also want to highlight important investments that we also announced this morning. Part of the research funding through the Canadian Institutes of Health Research will help better understand the mental health challenges that Canadians are facing as a result of living with COVID-19 and how and what measures can help with these particular challenges. Other parts of the funding will accelerate the development and testing of promising vaccines, therapeutics, diagnostics, and measures to contain the spread of the virus. These are all important steps that we're taking to help us fully understand the virus and how Canadians can continue to live with the virus in the safest and healthiest ways possible. The more that we understand it, the sooner that we will reach the new normal. I want to thank the research and academic community across Canada that is working so hard in so many ways to help us get through this difficult time and have the science and evidence we need to take those important next steps. Thank you very much.
Okay, thank you, Patty. And now we will hear from our Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Thank you very much, Christia. Over the past weeks, we've been working hard to mobilize the genius of Canada's industrial and research communities to tackle this global pandemic. Je suis très reconnaissant à tout le monde qui donne de l'aide.
I cannot thank enough everyone involved, the researchers, entrepreneurs, and small and medium-sized businesses, and large ones too. Together, we are all working for promising research to discover a vaccine to counter the virus.
Our government invested in the largest amount in Canada's history towards fundamental science. Drawing upon that foundation, we're unleashing the power of Canada's world-class researchers and scientists in responding to this crisis. I'm pleased to announce an investment of $40 million that will allow Genome Canada and CGen to coordinate a COVID-19 genome sequencing effort across Canada. Canadian scientists will sequence 150,000 virus samples and 10,000 human host genomes to understand how the human body responds to the virus and to track the evolution of this virus as it spreads. Canada is already an established international leader in genomic research. The results of this work will be accessible to researchers around the world to move ahead with this global fight against COVID-19. We're also providing the National Research Council with $29 million for the Human Health Therapeutics Research Center facility in Montreal, and building on the ongoing work to ready the facility for the production of vaccines for clinical trials. This funding will provide infrastructure and operational support to prepare vials for individual doses as soon as a vaccine becomes available. We're also announcing a further investment of $23 million in an important work towards the University of Saskatchewan's International Vaccine Centre. This funding will support preclinical testing and clinical trials of COVID-19 vaccine candidates. Next, we're also providing $600 million towards the Strategic Innovation Fund, the COVID-19 stream, to deliver direct support to Canadian companies for large-scale projects. This will help companies with promising vaccine treatment for candidates to move to clinical trials, as well as expand Canadian biomanufacturing opportunities so we can manufacture a vaccine in Canada when one becomes available. Grâce à ces investissements,
thanks to these investments and the measures we've taken over the past few weeks, we will ensure that Canada can develop, test, and manufacture vaccines and therapeutic products for Canadians.
Canada has some of the best scientists in the world, and I cannot thank them enough for their hard work, their ongoing dedication and commitment to addressing this mutual cause. So once again, thank you very much. Merci beaucoup.
Okay. Thank you, Nav. And now we will hear from Canada's Chief Science Advisor, Dr. Mona Niemer.
Merci beaucoup. On n'a jamais autant parlé de science collectivement et attendu avec autant d'impatience les résultats de la recherche pour informer notre présent et anticiper notre futur immédiat.
Anticipate our immediate future.
Unprecedented times. Science has been our best weapon in this pandemic, but we need more scientific knowledge about this new virus to overcome it and to ensure societal well-being. For example, we don't know how many people were infected with COVID-19 because it turns out many individuals may have been infected but show no symptoms. The current widespread testing, or PCR test, as you know it, checks the presence of the virus. So it provides important data on who is infected at a given time, which is now, when you do the test. Serology or immunity testing tell us how quickly, before I should maybe explain it. So serology testing actually checks for antibodies that are generated in response to an infection. So they tell us who has already had exposure to the virus, who was infected but didn't know it. Together, the two tests will give us a better idea of the rate of infection in the population. Serology testing will also tell us how quickly immunity develops and also fades. And this is important in guiding our recovery strategies. Other important information that we're still missing is how quickly the virus changes or mutates to escape detection, and whether certain individuals are more susceptible to infection or less able to overcome it. This is why the genomic initiatives is important. It aims at sequencing several viral isolates, as you heard from the minister, and determining the DNA sequence of infected individuals. Together, the immunity and the genomics initiatives will guide vaccine development and help prevent future infection. Un des défis majeurs de cette pandémie est de comprendre la réponse.
One of the major challenges of this pandemic is to understand the immune response to the virus, the percentage of the population that was infected, and why certain groups are more vulnerable to the disease than others. The answers to these questions will provide us with the knowledge we need in order to battle this disease and better plan the future. That is why today's investments that were announced will benefit all Canadians.
Announcement to enable immunity testing, genomic sequences, disease modeling, and vaccine research and development provide much-needed support for the research that will help us win the war against COVID-19 and will help our governments make evidence-informed decisions that will ultimately benefit us all. Thank you.
Thank you very much, Dr. Newmer. Et maintenant, je donne la parole au président du Conseil du Trésor.
And now, the President of Treasury Board, Jean-Yves Duclos, has the floor. Go ahead, Jean-Yves. Thank you, Christia. Clearly, we are facing an unprecedented health crisis and economic too. I'd like to give you a quick update as to the three pillars of our response to the crisis and the economic emergency. These three pillars are the Canadian Emergency Relief Benefit, the Canadian Small Business Loan, as well as the other emergency benefits. 8.9 million applications were received and processed for the CERB benefit for a total of 6.8 million applicants across the country. As for the Small Business Emergency Relief Fund, 351,000 small businesses have already received their approval for this loan. And a reminder for the emergency wage subsidy, since Tuesday, Canada Revenue Agency has provided a website for businesses, including...
Okay, we're going to pull away from this federal briefing. I'll just end on those two important notes from the President of the Treasury Board. Now, 8.9 million Canadians have applied for that Canada Emergency Relief Benefit, the $2,000 a month that you can tap into if you've lost your job because of COVID-19. And small businesses are also taking advantage of that small business loan of $40,000 that's now available. 350,000 small businesses in this country have received approval for that. A reminder that on Monday, next Monday, the wage subsidy program begins to open up for approvals on the government's website. But we want to take you now to Saskatchewan, where the Premier, Scott Moe, and the province's Chief Medical Officer are outlining Saskatchewan's plan to reopen its economy. Saskatchewan currently has 326 cases of COVID-19. Just 61 of them are active. Here is the Premier now.
And it's a plan that will be conducted in phases. And we will carefully monitor transmission and other factors during each of those phases, and we will adjust the plan if required. As we move through this reopening process, we will continue testing and continue contact tracing. And we will keep a very close eye on the numbers, while always remembering that these are not just numbers. They are people, and they are Saskatchewan people. At the same time, the economy is also not just numbers. It's not just some abstract concept. The economy is the job that allows you to support yourself and your family. And today, that job may be gone. The economy is the small business that you spent your life and your life savings building. And today, that business may not be open. They are also Saskatchewan people. So we have to find the right path. We have to find the middle ground that continues to keep our case numbers low and keep Saskatchewan people safe, while at the same time allowing for businesses to reopen and Saskatchewan people to get back to work. So with that goal in mind, here's our plan. Over the next several weeks, restrictions will be gradually lifted, adding more types of businesses to the allowable businesses list, meaning that they can reopen if they choose. All businesses and public venues will be required to continue following good physical distancing and cleanliness practices to protect both their employees as well as their customers. And customers will be expected to follow the physical distancing rules. And most importantly, to stay home if you are feeling unwell at all. All of the safe physical distancing rules and restrictions that businesses will be required to follow have been compiled in one comprehensive document called the Reopen Saskatchewan Plan. And this document can be found on the province's COVID-19 website. And it's also provided as part of the media package here today. These restrictions will be lifted in phases, and those phases and the businesses included in each of those phases are also outlined in that Reopen Saskatchewan Plan on the government website and in the media package. As always, if anyone has any questions, you can call our Business Response Team support line at 1-844-800-8688. So Phase 1 will begin on Monday, May the 4th. And on that date, medical services such as dentists, optometrists, opticians, chiropractors, physical therapists, and occupational therapists will be allowed to open. All medical service providers will be required to take precautionary measures, such as the use of gloves and face masks when physical distancing may not be possible. And because of this, we recognize that it is possible that some of these providers may not be immediately able to deliver all of the services that they normally would. As Dr. Shahab said the other day, with the weather warming up, and we are seeing that, people are wanting to spend more time outdoors. And that's a good thing, as long as it's done safely. So as part of Phase 1, some outdoor activities will also be allowed to open, with restrictions over the course of the next number of weeks. For example, parks will be open for boating and fishing on May the 4th, while overnight camping can begin on June the 1st. Camping areas will currently be operating at 50% capacity so that every other camping spot will be able to be empty. And until further notice, Saskatchewan's parks will be restricted for overnight camping to Saskatchewan residents only. The online reservation system for our provincial parks will open on May the 4th. Golf courses can open on May the 15th, just in time for the May long weekend. Golf courses and golfers will be required to follow a number of physical distancing rules, such as one person on a golf cart and elevated cups in the hole so that you don't actually put your ball into the hole and have to place your hand in the hole to retrieve the ball. Phase 2 of our plan will begin on Tuesday, May the 19th, just after the May long weekend. In Phase 2, currently restricted retail stores and some of the personal services will be allowed to open. Retail stores including clothing stores, shoe stores, flower shops, sporting goods stores, and electronics stores. Personal services allowed in Phase 2 will include hairdressers and barber shops, acupuncturists, acupressurists, and massage therapists. Again, all of these businesses will have to follow practices to protect their employees and to protect their customers. And those guidelines, again, are available in the comprehensive document that is provided on the government website. At this date, we do not have dates set for any subsequent phases. Those dates will be decided in the weeks ahead after careful monitoring and the impact of these first two phases. Phase 3 will see restaurants and bars reopen at 50% capacity. Other personal services that may not have been included in Phase 1 or 2 will be allowed to open in Phase 3. Phase 4 will see recreation and entertainment facilities begin to reopen. Those would include facilities such as gyms, swimming pools, theaters, casinos, and museums. And finally, Phase 5 would be the consideration of lifting some of the broader and the longer-term restrictions that are in place, but that would be considered many weeks down the road. Now, I know that some will be concerned that this is far too soon, that reopening businesses in the coming weeks could increase the spread of COVID-19. And I think it's important for us to remember that over the last number of weeks, there has been many retail stores in Saskatchewan that have remained open. Grocery stores, for example, hardware stores, pharmacies, banks, and liquor stores have all been allowed to be open, and these businesses, we have observed, have implemented new practices, limiting the number of customers in their stores, for example, ensuring physical distancing for the safety of employees and their customers, increased their disinfecting of all surfaces, and as a result, we have not seen major outbreaks that have started at Saskatchewan businesses. We have flattened the curve. even as these businesses have remained open over the course of the last number of months. This gives us confidence that Saskatchewan business can reopen and keep their customers and their employees safe by maintaining similar practices across the sector. That said, we will carefully monitor the case numbers each and every day, and we will adjust our plan accordingly if required. So let me be clear that many of the physical distancing restrictions and rules are going to remain in place. Restrictions designed to prevent some of the highest risk activities. And as we have said before, we know that travel was the source of many of the early cases of COVID-19 in Saskatchewan, and we continue to strongly discourage all non-essential interprovincial and international travel. And anyone who does return to Saskatchewan from any other country, including the United States, must self-isolate for 2 weeks. We know that some of the largest outbreaks in Saskatchewan were also due to large social gatherings like curling bonspiels or snowmobile rallies. The restrictions on public gatherings remains in place at this time. Other than allowable businesses, public gatherings remain limited to no more than 10 people. And we know that the largest risk and the deadliest outbreaks in our nation have occurred in our seniors' long-term care homes. So all current rules and restrictions for long-term care facilities will remain in place for the foreseeable future, and this is to keep our family members in those very facilities safe. By proceeding with caution, by maintaining restrictions in those most high-risk areas and activities, and by continuing with good physical distancing and cleanliness practices, I believe that Saskatchewan can find the right path. I believe we can carefully and cautiously begin to reopen our province while still protecting Saskatchewan residents from the spread of COVID-19. So now at this point, Dr. Shahab and I would be happy to answer any questions.
We'll take our first question from the floor. Staff?
Dr. Shahab, do you anticipate that when these restrictions are start lifting next month, that we are going to see an increase in COVID-19 cases? And if so, what kind of an increase can we expect to see?
So I'll just begin by saying that what we have learned over the last 6 weeks is as follows. We've learned that you can go shopping in a very safe way, as well as everyone follows the recommendations. So that means that business owners have to set up their business so that physical distancing is maintained, and people who go shopping should only go shopping if they are not unwell, and they also have to cooperate with the business to maintain that physical distancing. So based on that, we would like to see no increase when people are engaging in other allowed activities as it relates to commercial activity. We also have learned that when people go to work in essential workplaces, for the most part, we have not seen any transmission. But as long as people are observing the recommendations, including physical distancing, hand hygiene, not getting together in breaks to share food, even if there is a case, you may get some limited secondary transmission, but that is controlled quickly. So I think it will be essential that if we do see transmission in those settings, we are able to control that quickly. So that it means that as soon as someone is symptomatic, they self-isolate and call a health line for testing. So from that perspective, we will continue to investigate each case in detail and obviously control any transmission through case contact investigation, but also use that experience to further advise settings in which transmission has occurred. So that was for situations where physical distancing should be maintained. For areas where physical distancing cannot be maintained, we already learned from the healthcare system that you can safely care for people with COVID-19 and prevent further transmission either within healthcare workers or other patients. So those lessons have to be applied now in healthcare settings outside of hospitals, so a lot of the medical services which are in phase 1, and also have to be applied in other personal services that will be allowed in phase 2, where through appropriate use of personal protective equipment and other measures, you can safely provide services which are less than 2 meters, where physical distancing is not maintained, in a way that limits further transmission. But again, if transmission was to happen, we will investigate in detail, understand what was there that could have been improved, and advise and provide that feedback to the providers and to the public. So we will see ongoing transmission. We hope that will remain as low as possible. We want to see the curve remain flat during the reopening phase, and we want to learn from that and provide continuous feedback.
Follow-up, Steph?
Yeah, for the Premier, I understand the need for people to get their teeth cleaned and for their hair to get cut, but these seem like relatively high-risk activities because you can't maintain physical distancing performing those services. So why are those in the early phases of this plan and not in the later?
Well, listen, the entire plan, including the phase one, the personal services, has been worked on in consultation with not only Dr. Shahab, but also the Saskatchewan Health Association. And we have, in phase one, the number of services are personal health services, if you will. These are also services that, to a large degree, practicing with personal protective equipment, practicing providing their service is with the proper standards in place with respect to cleanliness, with respect to disinfection, is not foreign to these services. For example, at a dentist office or many of these services that are being provided. So this is an extension really of some of the healthcare services that are already being provided across the province. Some of these services have been provided even throughout the last number of weeks on emergency basis, if you will. And so this is what we had felt collectively is a good place to start to reopen some of the services that the Saskatchewan people require, and then a second wave of those personal services will be coming in phase two. But I think it's also important for us to understand that between these phases, and we have put dates on phase one and phase two, but not on phase 3, 4, and 5. And those dates will be determined by the results that we see as we step into this area of reopening businesses and services in the province.
We'll take our first question from the phone line. Operator?
We have Murray Mandrick with the Leader Post.
Good morning, sir. Given that you don't have a date for phase 5, which is the big crowds, isn't that in essence saying that we just cannot plan for Rider Games, the CFL season, Big Valley, Country Thunder Jamboree? It would seem to be that that none of this will be permissible by the time, by a realistic time, anything will start.
Well, yeah, without having dates on phases 3, 4, and 5, I think what that speaks to is those dates would be determined as per the results that we see with the implementation of phase 1 and 2. If we start to see a small increase in active cases here in the province, which I don't think would be unexpected, but a manageable increase here in the province, that we would then have a good look at the next phase. I don't think we would be looking much past the next phase over the course, being phase 3, over the course of the next number of months. This needs to be, primarily about keeping Saskatchewan residents safe, but it also is focused with finding that right path, finding the path of how we can open up some sectors of the economy that have not been allowed to be opened up over the course of the last number of weeks, and allow people to get back to work. So the results during phase 1 and phase 2 will ultimately determine the dates for future phases. So I don't think it's a time yet for us to make comment on large public gatherings. We just don't have the information at this point.
You have a follow-up, Murray?
Yeah, but given that phase 2 starts on May 19th, and given that you'll need a considerable period, one would think, to calculate the results, we're looking probably June, July before we're even into phase 3. So phase 4, phase 5 doesn't seem like they're going to be something that are going to happen this summer.
That would be you know, a conversation that we will continue to have with all of those that are interested in having that conversation, whether it be the CFL or other sporting leagues, whether it be minor sporting leagues that are where our youth are participating in you know, sports right across this province. I know in the community where I live, there's youth dance, there's youth ball, there's softball, there's kids that want to play lacrosse. So that's just at the minor level. Never mind the large, the public gatherings that we would have with professional sports and other events like, for example, Country Thunder that we know many people would like to attend. But it's just too early for us to make any determinations with respect to whether or not those types of gatherings with those that number of people would be allowed to carry on. If you have anything to add from your perspective, Dr. Shahab, but I think it's fair to say this isn't a conversation that we've been focused on exclusively as of yet, as we're trying to work through the first number of phases and ensure that we have the tools in place in the way of testing capability, contact tracing, and the ability to isolate localized flare-ups today.
So just what I'll just like to add is that, like the Premier said, you know, it's really positive that we are able to reopen in a very organized way. And the reason we can do that, again, as the Premier said last evening, is because we've all been practicing physical distancing and other measures to keep the curve flat. And so as we go forward, it's not really back to business as usual. It's going forward to business in a new normal for the next little while. And we will continue to learn from that, but we already know that settings where there's close proximity of people in gatherings, where there's shouting, singing, laughing, crying, hugging, or other close contact, we already know transmission happens very quickly. We have a reproductive transmission rate, RT, of less than 1, which means that each case transmits to less than 1 person, and that is essential to keep the curve flat. We already know that in gatherings in Saskatchewan, we've had situations where one person has infectious person has resulted in transmission of 10, 20 people. And so again, that is the risk of large gatherings. And at this point, that's why those are not being allowed. But we need to continue to learn from what we see and see what would be the possibilities in the future to maybe allow some events in as safe manner as possible. But like the Premier said, at this point, we need to understand how we can safely allow some businesses, some recreational activities where the risk is already low by virtue of how they happen, and learn from that, and then move forward in a very systematic way. Thank you.
We'll take our next question from the phone line. Operator.
We have Bonnie Allen with CBC.
Yes, can you hear me?
Yes.
Hello?
Yes, we got you, Bonnie.
Yeah, okay, thank you. You've noted that aggressive testing is key to this strategy, but we've seen the demand for testing decrease despite your capacity. Fewer people are seeking out the tests. So when are you going to stop doing defensive testing and start doing offensive testing, not just in response to people and symptoms?
I think Dr. Shahab would be best to answer that question. I would just at the outset state that when we have access to testing capability that may be able to test antibodies, for example, we may look at a little bit of different testing parameters that Dr. Shahab may speak a little more in depth to. But at this point in time, we have one of the most accessible tests, if you will, for residents in Canada is right here in Saskatchewan. We do have the capacity to go beyond the testing numbers that we have today, and we are fully prepared, if needed, to provide those tests if required. Dr. Shahab.
Thanks. So just a bit of details on the testing capacity as it stands today and the testing numbers. So obviously we have the capacity to do in excess of 1,000 tests a day, like the Premier said, a target of 1,500. Testing has gone down, like the SHA said in its media briefing, due to a variety of reasons, less coughs and colds, less people getting fevers. And yes, we want to make sure that anyone with any symptoms, even during flu and allergy season now, as we get into that, does consider testing if their symptoms are unusual. Call Healthline. That's one way of maintaining and enhancing testing once cough and cold season, flu season ends. We are very reassured by the fact that overall our testing numbers have been 23,000 plus, with a test positive rate of 1.3%, so fairly low, which means that we are doing a lot of testing. If our test positive rate overall had been higher, we would have been concerned that we need to do even more. And I have to also emphasize that we looked at our numbers from last week. So 13th to 18th April, we did in excess of 4,000 tests. So not as much as more than 1,000 tests a week, but slightly less than that. But even there, our test positive rate was 0.4%, which again is very important, because what it means is that even though we had a lower overall number of tests, and we want to maintain that as high as possible, our test positivity rate is not high, which means that we are not missing cases based on that number. Having said that, we do want to increase our focus on testing where there's a cluster or an outbreak, either in an institutional setting where we may test everyone, even if they're asymptomatic, or in other settings where it may be useful to understand a bit more that are there mildly symptomatic or asymptomatic cases within the contact. But having said that, I think that is also a reflection of why we also need to do everything else at the same time, which includes physical distancing at all times, because we do understand that in rare occasions transmission can happen when a person may not be symptomatic and may not even be aware that they are infectious. So testing is important, maintaining physical distancing is important, and case contact follow-up right away is important. So all these three pillars are essential as part of the offensive strategy.
Do you have a follow-up, Bonnie?
Yeah, you noted the recommendation that interprovincial travel not be done unless it's essential. But what consideration have you given to beefing that up? Something with a bit more teeth, further restrictions or enforcement, highway patrols, anything that would clamp down on people going to and from Alberta, for example?
Start that, and I'll maybe end.
So I think at the end of the day, individuals to a large extent need to do a risk assessment of the need to travel. And I think so far what the feedback we've been getting is that people have been doing that very in a very conscientious manner, not just for interprovincial travel, but even travel within the province. I think people enjoy the outdoors close to their homes. As they look at recreational activity, it will be close to their homes, not a lot of travel even within the province that's far from your own home. So for the most part, people have been very conscientious, and at the same time, we understand that there has to be travel that may be essential from a business perspective, or that may be essential from a family perspective, that really does need to be supported in a safe manner. So from that perspective, I think it's less a matter of someone policing this behavior, but rather a matter of individuals just making that risk assessment and keeping travel as low as feasible, and even information from Google Analytics and other third-party demonstrates that for the most part people are staying at home or close to home, which really needs to continue.
We'll take our next question from the floor. Arthur?
There's a few things that I don't see in this plan, and that includes when schools and also universities.
Okay, we're going to pull away from this press conference in Saskatchewan. But if you want to continue watching, you'll find it on our website. Let me bring in my colleagues, Vashi Kapelis and the CBC's Catherine Cullen, just to go over some of what we've heard over the past couple of hours. I mean, I found that actually pretty fascinating because it gives you a real picture into how things might start to relax in a very restricted way. With two dates mentioned, May 4th being the first phase and May 15th being the second one. Vashi, I'll let you start.
Yeah, I'm just like you, Rosie. I was clinging to every single word to see exactly how they're going to roll this out. So overall, it's a multi-phased approach, but the only dates detached so far, as you point out, are to the first phase, which kicks off on May 4th, and the second phase, which kicks off later in May, I think towards the 19th. The first one is kind of opening up the outdoors. So parks, you can launch boats, you can golf, although, as you mentioned, with some restrictions, you won't be digging in the hole, for example. If you're lucky enough to get the ball in, there'll be something that elevates it a little bit, as well as medical services that were closed down in light of COVID-19. Think about dentists and optometrists. Later in the month, as I mentioned, phase 2 includes stores and businesses that were forced to close, that were mandated to close, clothing stores, flower shops, hair salons, as well as services like massage therapy. Daycares, restaurants, that's all in the later phases, and as I mentioned, no specific date on that. Still a number of restrictions in place, and you heard the Chief Medical Officer reference them there, talking about travel. They're still limiting travel. There's no restrictions being relaxed there. He's even saying if you do partake in the activities we're allowing, make sure you do so sticking to home. Gatherings continue to be limited to 10 people as well.
Okay, I've only got about a minute, Catherine. I mean, I noticed one of the first questions was, can I go to a Riders game? Because it's Saskatchewan, and the answer was no, but at least you can get a haircut.
And we talked about curling bonspiels, too.
Yeah,
it was deeply Canadian, Rosie. I think the important thing to highlight is that the dynamics in Saskatchewan are very particular, right? I believe it's 326 cases, 4 deaths that they've seen over the course of this, so the decisions they make are particular to what's going on in that province right now. I was speaking to an official from another province who said, you know, when decisions like this are made, yes, it puts pressure on them in their own province to perhaps go ahead with this, but at the same time, people are going to be watching this as something of a test case to see how it goes, not only how the measures work, but also a question of how many people, how people respond to this. Will they be flooding the golf courses?
Yeah, both things to watch. Okay, thank you both very much. Catherine Cullen, I'm sure you'll see her on The National tonight. And Vashi Kapelos has an interview with the Premier Scott Moe on her show, Power and Politics, later, so tune in for that. Thank you both. So just summing up a little bit of what we heard there, not only Saskatchewan's plan to reopen, which everyone in the country will be watching very, very closely, and other provinces will slowly start to follow, but also the federal government's announcement today, which is really another way to start finding a way to have those restrictions lifted. $1 billion in funding for science, research, vaccines, to get a better sense of how we can stop this pandemic, control it, and stop it from spreading further.